We got a beautiful session planned today. I'm going to hijack a little bit of this class for my own personal well-being. Um, I haven't been sick in probably 2 years, and I wouldn't call it sick, but I got like some sort of a cold because now that masks are becoming less of a thing, then, and I've been going to the public pool with my kids. Anyways, I think on Saturday, Sunday, I came down with some sort of a sinus thing. So I'm on the mend. I'm feeling way better, but I have a little bit of congestion. So if I cough today, I'm sorry. But what I'm going to do today, yeah, I know. But what I'm going to do today is I'm going to show you guys how to use movement, massage, and meditation as you're trying to or working through a healing process where the body's already working towards healing, and how can we support that? I hope you guys don't mind. We're going to be doing some of our normal movements too, but this class will help you kind of understand how to take what we always do in these classes, and then how we can use those types of things to help our body recover. I really don't like to take things like people are asking me, oh, did you take this oil? Did you do this herb? Did you do this, do that? And there's nothing wrong with that. I just personally don't. Um, so I like to use a lot of, you're welcome, Cindy. I like to use just natural, let my body do what it does and support that. And I think that there's a lot. The mind, just as an example, is the most powerful pharmacy. Good morning, Janice. So we can create a lot of a good chemistry or encourage good chemistry to manifest in our body, just with using our imagination. So we're going to do that a little bit today. The opening warm-up will involve a little bit of an elongated self-care or self-healing process, and then we'll get a little bit further down on, I don't know if we're going to do it standing or sitting yet. We'll have to see what I do. But anyways, it should be a lot of fun. I hope you guys enjoy it. If at any point I start coughing, please don't be alarmed. It's more of like a tickle. It feels like that's going on. I haven't coughed. I haven't had a cough related thing in like 10 years. I thankfully I just haven't had that issue. But with whatever I had gotten, it tickled me. So now I'm like type of thing. So anyways, no alarm. Just please forgive me ahead of time, and we'll get the show on the road. All right, so it's 8:02, and you know I like to get started right at 8:02 at the very latest. Thank you for showing up today, and let's get this show on the road. All right. So let's start from a seated position. Go ahead and sit down, get comfortable, and turn your attention inside. Remember, we're going to be doing some movements today that will help us help our bodies to do what it does best. So from a seated position, what I want you to do is place your hands gently on your abdomen. And remember, this makes up a big part of our immune system. So whether you have the summer seasonal allergy thing or whatever it is, this is the place to go to first and foremost. My Hawaiian teacher would frequently tell me that allergies come from different types of unsettled stomach. So what we're going to do is we're going to take our hands clockwise circles on the abdomen, nice and easy. Make sure you're pressing through the crown of the head so that you're nice and long while simultaneously leaving those ribs down in front. That's very, very important. Oh, forgot to press start. Start. Okay. So with your clockwise circles, I want you to also focus your attention on your breathing. So you're going to breathe in slow and exhale even slower. From here, let's take one hand in the front, one hand on the back. So remember, you can be either using the back of your hand to massage the backside or the palm of your hand. I like to use a combination of the two because you'll notice that the shoulder goes into a different range of motion depending on how you have your hand positioned. So you can be addressing, mobilizing the forearm and the wrist simultaneously. Let's go ahead and switch. So now let's take the other hand towards the back, nice and easy. Make sure to make those breaths very slow and gentle. Now, if you need to take one of those deeper, more aggressive, more expansive breaths, feel free. But remember, today, I'm focusing primarily on recovery after a summer cold. Actually, it could be recovery from anything, but specifically respiratory-oriented stuff. Stuff is a very clinical word. All right, so from here, what we're going to do is we're going to take our hands and draw our fingers towards the center. Now, as you draw your fingers towards the center, what we're doing is we're reminding our abdomen to be soft, because holding tension in this area tends to be counterproductive for the functionality of everything that lives there. So we're letting go of tension, pressing through the crown of the head, so we're nice and long through the spine. We're just letting go of unnecessary tension. Now, as your, and I don't know what your stomachs look like, I don't need to know, but if you have a little extra love there and you feel uncomfortable with massaging your stomach, that's a great reminder to really refine your willingness to love yourself as you are, knowing that loving yourself is going to be the best way for your body to relax and actually get into a mode where it can do its jobs, plural, more efficiently. Digestion, overall immunity, everything goes better when you're relaxed. From here, we're going to take our fingers and we're going to walk our fingers around the abdomen, nice and easy. You know, if there's any space that you feel that, needs a little bit more attention, feel free. Make sure that you're walking your fingers along the underneath the rib area, and also all the way down to the ilium or the hip bone on the sides, and also down in the front. So right above the pubic symphysis area, make sure your fingers are making the way all the way down there. Nice and easy. Take your time. And some of this work is kind of like, well, what am I doing? If I squeeze my neck muscles, I can feel, that feels real good. But sometimes we don't know exactly, like, well, what am I doing here? Well, you'll notice that within a matter of a couple minutes, but definitely if you did this for up to 15 minutes, research-wise, they've shown that within 15 minutes of doing any type of massage, but especially this area, our body starts to release those feel-good hormones, right? So serotonin, dopamine, whatever else our body has in terms of helping us to feel good and relaxed, that's what happens. So we're just walking our fingers around. Make sure that you go around in the center as well. Nice and easy. From here, let's take our hands across the belly, through the side, and into the back. Okay? So if I turn around real quick, you can see I'm coming all the way to the back side. This is massaging my kidneys. And you'll notice too that I have a little rotation happening in my thoracic spine, also cervical and lumbar, and that rotation helps to open up the lung system. Any movement where your scapula is moving along the rib cage assists in opening up the lungs. Oftentimes when we have a lot of shoulder tension, it ends up impacting our breathing. So shoulder mobilization, specifically of the scapulothoracic joint, very important when it comes to the health of our lungs and the functionality of our lungs. Okay, let's go ahead and do a squeeze on the ascending and descending colon. So you're just going to take your hand, one on one hip, one on the other, and you're just squeezing in the ascending and descending colon. Nice and easy. Remember to breathe throughout this whole process. Your breathing should be elongated, nice and smooth, nice and relaxed. Breathing in a nice, relaxed way. Okay, so from here, let's go ahead and take our right hand, and we're going to do some strokes down from the opposite side of our neck, down through the side, through the sternum, and into our abdomen, switch sides. So you just take the full palm, stroking down through the neck, through the sternum, and into the abdomen. Keep yourself nice and relaxed, nice and calm. Make sure your breath is expansive but gentle. Nice and relaxed. This is stimulating the flow of our lymph. Especially wonderful if you've had, a lot of inflammation in the head area. Sometimes we get those sinus headaches because of the allergies or because of the head cold or the summer cold or whatever you want to call it. So this is a great way to get that lymph going to where you want it to go. When you want to pump your lymph system, you always want to make sure you hit two places for sure, neck and stomach. If you take a manual lymphatic drainage class, like with massage, they'll usually tell you neck first, then stomach. I do the things that I like to do, and that's work this area first, and then I usually make it to the neck. But make sure you hit those two places to stimulate your lymphatic system. And what you're doing is you're stimulating where the lymph is going to go. You're showing you're opening up the highway for the fluid to go back into the heart. And when you do that, it creates a vacuum for the fluid from the other parts of the body to flow. So no matter whether you're dealing with a sinus or a cold issue, or whether you're dealing with a healing from any type of issue, this is a good way to stimulate that process. Nice and easy. Okay, so from here, we're going to do a little bit of massage for the lung meridian. The lung meridian basically comes from the top right underneath the clavicle, all the way down the front side, through the bicep, through the brachioradialis, and down into the thumb. So what we're going to do is we're just going to do some gentle strokes all the way through to the tip of our thumb and right back up, and then switch sides. So you're just stroking all the way through. You can add a little bit of stretch as you go about that movement here, and then switch sides. Remember to keep your breathing slow and elongated. Really taking that breath deep into the bottom of the lungs. A lot of times we become chest breathers and we breathe mostly with the upper portion of our, breathing into the upper portion, or breathing with those muscles of forced inspiration. And what I want you to do is I want you to focus on really expanding those lower ribs, front, sides, and back, as you massage all the way through to the thumb. This is the lung meridian. Nice and easy. So as you're massaging, sometimes you have a part that wants a little more love. I want you to honor that and give yourself that little extra attention. Sometimes, like, let's say that you're not dealing with a lung issue this morning. And congratulations, I'm happy for you. And at the same time, when we do this type of a practice, you can start to explore and discover other aspects of yourself. So this is intimacy with the body, intimacy with the meridians of the body, which helps cultivate capacity. Dr. Tony Evans uses that philosophy of intimacy cultivates capacity. So anything that you want to improve on, you're going to want to spend some time with it. Okay, about another 15 seconds of this action here. Nice and easy. Nice and relaxed. All right, so from here, we're just going to do a really brief sinus release for the head, neck, and face. So what you're going to do is you're going to take your fingers on the top side of your head, and you're just going to press right in the center. You're going to hold this for about 3 to 5 seconds, and then we're just going to stroke off to the side, all the way down through the neck, all the way through to the stomach. Let's do that 3 times. So pressing from here, just imagining the cranial bones, the bones in your skull, relaxing. Breathe deeply and expansively as you go, nice and relaxed. Pressing through the crown of the head so you're nice and long. Just relaxing the bones of the scalp, or of the head, nice and relaxed. So from here, we're going to take our fingers into the hairline. You're just going to press right in the center. You can couple this movement with your breathing. And just allow your facial bones to relax. And we're just doing this about 3 times. Nice and relaxed. All right, from here we're going to press in the center of our head, like in our third eye. So you're pressing right in the center of your forehead and coming out to the side, down through the sides of your neck. So press in the center, nice and gentle. Remember, focus on relaxing those facial bones. I gotta be honest, like since we started this, I haven't had any tickle or cough so far, so go figure. Nice and relaxed. Helping the body do what it does best. That's what it's all about. All right, so from here, our next one's gonna be right in between the eyebrows. So you're gonna press right in between the eyebrows and follow the brow line all the way down through the sides of the neck. And then again, just allow those hands to just cascade all the way down to the stomach. Almost like you're just draining everything out because that's where everything drains anyways, right? So pressing right in the center, going out to the side, allowing your breathing to be nice and relaxed and gentle the whole time. Okay, so from here, we're going to pinch along the supraorbital ridge. So that ridge of bone right above your eyeball, you're just going to pinch, starting at the center and working your way out to the side. Just a really gentle pinching motion. Imagining the muscles and specifically the bones around the face and around the eyes relaxing, around the sinuses, relaxing. So we're just pinching very, very gently. And you'll notice that there's little divots along the way. And those divots are often areas where nerves are coming out of the facial bones. And when you stimulate those and relax those with a nice gentle touch, it helps to create a relaxation effect within the facial and sinus bones. And I can already feel things starting to drain on myself here. Now from here, I'm going to take my fingers and I'm going to glide through my brow 3 more times. So I'm kind of connecting all those dots. If I was squeezing and I made dots along my supraorbital ridge, now I'm connecting them all with a nice gentle stroke. From here, we're going to go on the infraorbital ridge. So you're just going to take your finger, your index finger, and you're going to press right in the bottom of your infraorbital ridge. Now, if you have contact lenses, please be careful. Oftentimes for me, what I like to do is actually take the top side of my finger and massage my eyeballs. Feels really, really good. That probably looks pretty weird. I'm not looking at my camera right now, but anyways, from here, let's go ahead and connect all those dots. So you're just taking your fingers out to the side. This is really good also for those morning bags, you know, like sometimes you wake up real puffy under the eyes. Maybe you didn't get good sleep. Maybe you had a couple things going on last night. And what we can do is we can help to encourage the flow of lymph by doing it that way. All right, from here, you're going to take your finger pads and you're going to come right into your cheekbone right here, and you're just going to press into this area and give it a nice gentle friction. As you do that, breathe in, breathe out, nice and slowly and expansively. Really, really good. And then from here, what we're going to do is we're going to take our fingers on the side of our nose and we're just going to pull outward. And as we pull outward, you're going to breathe in very gently and expansively. And if you want, you can carry that stroke all the way through your face, down through the jawline, down through the neck. We're almost done with this, guys. Hang with me. Okay, so you're just taking your fingers right along the side of the nose, and you're opening up the sinuses. Okay? And then from here, let's go ahead and just wrap this part up just by doing some nice sweeping motions with our fingers and hands out to the side, draining all that fluid down to where we want it to go, which is right back into that subclavian vein. Okay, nice and easy, nice and relaxed the whole time. Okay, everybody. I think it's time to get on to some more movement. So what we're going to do is we're going to get down onto the ground and we're going to do a little bit of rolling this morning. Remember, most of the stuff today is with regard to recovery after we have some sort of a sinus dynamic or cold or flu or whatever else you got going on. All right, so from a supine position, we're going to take our arms above our head while keeping our ribs down in front, and you're going to slowly drop the knees from side to side. Now remember, as you do all your movements today, make sure that you're breathing nice and slow and relaxed. You know, like with my situation, I had a tickle going on. And so when I breathe in very fast and aggressively, sometimes that tickle sensation manifests. So right now I'm focusing on really nice and slow and relaxed breaths. From here, I'm going to go ahead and roll all the way onto my side and then switch sides. So my arms are above my head. I'm rolling onto the side. And what I'm doing here is I'm focusing on massaging the muscles in between the ribs. And I'm also massaging some of the muscles on the back side, the serratus posterior superior and the serratus posterior inferior. Those are muscles that help our ribs to expand when we're breathing. And as we massage or roll onto our back, you just allow your brain to tune in to the sensations that manifest as you're pressing your back into the ground. Nice and easy. Okay, now from here, we're going to get into some rocking. Rocking is really important all the time, but especially after you've been sick, because this is a movement that massages the back. So let's go ahead and tuck our butt underneath, pressing our low back into the ground, and we're just going to start to rock forward and back. So you're just going to take your body and create a little bit of a curve through the back side and rock forward and back. Oh, this is so good, especially if you've had to kind of work through any type of sickness that you might have had, and maybe you've been slumped over your computer and the back muscles get all tight and sore. This is really good for that. Really, really productive. Now you can start to add this one by straightening the legs when you come onto your backside, and this helps to stretch the posterior line of connective tissue in the body. Remember, we look at movement through the lens of nutrition. We want to think about what are the movements that we aren't getting and make sure that we're adding those. And then also think about the movements that you're always doing and do things to offset the effect that those movements have, or those lack of movements have. Okay? Now from here, we're going to move into our side sit position, and we're going to get into some hip mobilization techniques. So again, from a side sit position, one knee's bent in front, one knee's in back. Let's just post some hands behind and start to shimmy those hips from side to side. Nice and easy. Sometimes what happens when we get sick is we find ourselves, trying to rest so when we're in bed, sometimes we go to our go-to position. So like for me, it's side lying. When I'm on my side, I can fall asleep no problem. But oftentimes what happens is our body is in a less than ideal position when we do that. And so sometimes some discomfort can manifest. For me, it happens in the SI joint. Sometimes I have SI joint discomfort. So the first thing I need to do is not worry, because it's all good. I've beat that several times in my life. And the first thing you do is you don't worry. The second thing you do is you mobilize that area of your body without tension. Okay, so that's what this is all about. If you want to take the hands out of it because you've mastered the side sit position, feel free. You can always add to this by taking your arms into different positions. I like to, especially because today I'm focusing on recovering from a respiratory dynamic, I like to add movements that incorporate arm movements as often as possible. Remember the lung meridian? The lung meridian needs to move nice and slow and strong. Okay, let's go back onto our backside for another set of rolls. So get on your back. This time what we're going to do is we're going to lead with the arm. So you're going to take the arm across the body. You can straighten your legs if you like. We're just going to reach through the arm and we're going to open up that lung meridian by tucking our thumb underneath and letting our fingers raise towards the ceiling. Let's go ahead and switch sides. So you're just reaching with the hand towards the ceiling, and then you're tucking that thumb underneath, and then adding some gentle arm rotations and different movements to open up that line. Remember, through any of the movements that we do, guys, you guys can always add a massage aspect. So I can really add to everything that I do. And, you know, I hope you guys are just taking my suggestions as like a starting point and then adding your own intuitive aspect. Nice and strong, nice and relaxed. Okay, let's go back into our rocking. This time what we're going to do is we're going to come to an upright seated position and add a reach. Okay, so again, if I want to add something with the lung meridian, I can tuck those thumbs underneath and I can add a nice gentle stretch through the top side of the wrist. This is really good for de Quervain's tenosynovitis. It's the tendonitis of one of the thumb muscles. So I can reach. We could also add our reaches towards the ceiling. And we can also add our reaches towards the back. But just be sure to try to use those back muscles to get you there. It's not wrong to use your leg to pull, but you want your back muscles to be moving as well and to be activated. So rock it. You want to add a different leg position, feel free. Same arm, same leg, reach. You can do opposite arm, opposite leg, reach. Whatever you like. Take it nice and easy. Breathing in nice and slow. Exhaling even slower. You got the burps? Burp it out. Got some gas in there. Let it out. Got some gas going some other place? Let it out. There's more room outside than inside. Probably there by yourself anyway, so you're all good. If not, say excuse me. But don't hold it in. That's the main thing. All right, so from here, from our rocking back into our side sit transitions. So this time when we do our side sit transition, we're going to add a gentle rotational reach. So we're going to pivot our knees from side to side or swivel our knees from side to side, and we're just going to add a beautiful rotational reach through the ribs, through the thoracic part of our spine. Now, obviously, your lumbar spine rotates and your cervical spine rotates much more than your thoracic, but we want to get a little bit of movement there as well. You could take in a breath when you're in the central position. As you exhale and you go into your rotation, let it out. Add some gentle looking or some cervical movements, some neck movements, looking around in your room, wherever you are. And just really allow your body to relax. You know, whenever you have a cold or an issue where you're coughing and sneezing or whatever it is, blowing your nose every other second, you really want to massage the muscles that we used for forced breathing. And we could do that with our hands by actually massaging into those muscles, or we can move, or maybe a combination of the two, whatever you like. Know I'm all about that, whatever you like. Okay, guys, let's go on to our back one last time for one more set of rolling. This time we're going to roll all the way onto our abdomen. So with your legs straight or bent, choice is yours. I like to kind of bend one leg, and then I'm going to roll onto my abdomen nice and slow. And then once I get there, I'm just going to rock my hips from side to side. I'm going to breathe in, I'm going to breathe out. You know, sometimes after you've been sick, your bones feel all achy or your joints feel all achy. So this is a reminder to relax. That's what that is. Relax those areas so that you can get good circulation in. And then from here, squeeze the glutes, bend the knee, reach that leg behind, come to your backside, switch sides. So roll onto your abdomen, nice and slow. Rock those hips from side to side, relaxing. Just surrender unnecessary tension. You don't need to hold yourself in any specific position. In fact, your gripping and tightening is probably more counterproductive than anything else. Mobilization is a very important aspect in the recovery process after being sick. Squeeze the glutes, bend the knee, reach the leg behind, and go on to your other side. Nice and relaxed. You can come up a little higher on your elbows if you like. Just, surrender any tension out of that spine. Relax, breathe. Lower yourself down. Get ready. Squeeze the glutes, bend the knee, reach it behind. So you're using those posterior hip muscles to kind of get you where you want to go. Okay? Nice and easy. Okay, guys, last set of rocking. So this time when we do our rocking, forward and back, if you want, you can add a get up. I don't want to assume that everybody's recovering from a cold, but if you are, we're going to add modifications for that. But if you're not, go ahead and feel free to get what you need out of this workout today. Add your get up. Your get up is so critical. Even for a person that's trying to get to the recovery process, it's really a great example of what we're doing. We're getting back up after we've been down. Okay? So focusing on the fluidity of movement, rolling down, coming back up, making our movement smooth and strong. Use your hands as much as you need to. If you need to use your hands to get up, that's cool. Use your hands. But remember, we want to be as efficient with our movement as possible. Efficient. Not work hard. We want to work as little as possible. And make a habit of doing that all the time. You'll actually burn more fat moving in a relaxed way than you will trying to go, Arr! Or however you, whatever it is, you know. Okay, last set of side sit transitions. So this time we're going to add a hip hinge and a hip press. So we're going to swivel our knees, go into a nice hip hinge, add some gentle movements to massage through the hip, and when you're ready, use the legs to press yourself up and lower yourself right back down. Swivel the knees, hip hinge, hip press, come right back down. That simple. So if you want to, again, take the hands out of it, feel free. Make sure that you're breathing in a nice, slow and elongated fashion. If you want to add some reaches, very, very helpful. Nice and strong the whole time. Strong. Breathe in, breathe out. About 20 seconds left. Practice really pressing into the ground with your legs. Maybe you can imagine carrying a load. For me, I always like to use stones. And then add my gentle reach. Okay? All right. We're going to move into our next series of movements. We're going to start from a knee hand or a foot hand crawl position. So tabletop, whatever you want to call this, you're on your hands and knees. You can use, if your ground is really hard on your knees, you can put something underneath. Or you don't have to. You can always leave that out of it. I just do it because it feels comfortable. And what we're going to start is with some spinal articulations. Maybe you could call it cat and cow. So you're just going to drop your belly towards the ground or your sternum towards the ground and then lift your mid-back towards the ceiling. So we're just doing some gentle cat and cow. Trying to focus on distributing movement evenly throughout the spine. So I want you to feel the joint in between each vertebrae. Now, if you have a section of spine that moves more than the other parts, we call that a hinge. And what you want to do is you want to notice those areas and then distribute your flexion and extension more evenly. Very, very important. Now let's add a little bit of side-to-side motion. Again, allowing or focusing on elongating the breath. Maybe add a little bit of a circular motion of the spine, both directions. Nice and slow and elongated through the breath. I have to be perfectly honest, I'm kind of surprised I haven't coughed yet. I guess this stuff actually works. Good times. All right, now we're going to come down onto our stomachs for some Superman push-ups. Basically, it's prone extension. So we're on our stomachs, and what you're going to do is you're going to take your arms out to the side, almost like a goal post. And what you're going to do is you're going to squeeze through the glutes, you're going to press through the crown of the head, and you're going to extend, lifting your arms off the ground. Now make sure that you're squeezing through the scapula, through the rhomboid area, and even the lower trapezius. Okay, and then after about 5 to 10 seconds, you're going to lower yourself right back down. If you want to put hand over hand and rest your head, maybe rock your hips from side to side, focusing on that relaxed breathing. Feel free. Now when you're ready, go ahead and get it again. So we're starting at the base of the spine by squeezing the glutes. We're going to create stability through the spine by squeezing through the glutes. You're not going full bore, but what you're doing is you're kind of tucking your butt underneath and then extending through the spine. So it's the position that we want to focus on, not necessarily the hard contraction. And again, you can count yourself down either from 10 seconds or 5 seconds. You can reach your hands out to the side if you want. I always like to imagine maybe I'm swimming, doing a little breaststroke action. Nice and strong the whole time. And then lower right back down. Relax those hips by rocking from side to side. Surrender unnecessary tension. Okay, one more time. Let's go ahead and squeeze the glutes. Press through the crown of the head. Bringing our arms out to the side. You can either use the goalpost position or straight arms. Choice is yours. You want to add a little bit of circular motion to get a little movement. Feel free. Inhale, exhale, nice and slow, nice and smooth, nice and strong. All right, guys, lower down. One breath cycle here. Just relax as much as you can. Relax your neck muscles. Relax your spine. Okay, slowly, gently, easily, let's roll onto our backsides. This time we're going to do a hollow hold. You can either do a hollow body hold or you can do some extension. So what that's going to look like is you're going to take your knees bent. You're going to press your low back into the ground. You're going to take your arms above your head and you're going to take your legs out in the opposite direction, and you're just going to hold this position for about 15 seconds. Now, if you want to hold it longer, you're more than welcome to do so. For me, because this is a recovery movement process for me, I'm going to take some breaks. And my break looks like this. So I'm just going to let my knees drop from side to side. I'm going to let go of tension as much as I possibly can. I'm going to imagine my body beautiful, healthy, and strong from the inside out. I'm going to pepper that observation and that imagination with gratitude, giving thanks for the fact that I do have health and that my body has the ability to heal. It's very important to tune into that. Okay, let's do it at least one more time. If you've been holding this hollow body position the whole time, good for you. Just got one more set here. Breathe in, breathe out. And go ahead and lower it back down. Let's use some rocking to come up to a seated position and then back into our tabletop or our knee hand crawl position. So rock up, come back into your knee hand crawl position. This time we're going to do a little bit of a hip-oriented mobilization by doing some step outs. So from your knee hand or your foot hand crawl, we're going to step out into different directions. So I can step to the side of my hands. I can step out to the side. And you can always add to this, right? Like if I step out, I want to see what happens if I take my hands out of the equation. Step out, put some weight into the joints in a functional way. Maybe we got to pick something up, put it up over my head. Who knows? If it's more than enough to just step out, that's good too. Get exactly what you want out of this movement practice today. And add variables, modifications that work for you. Okay, let's go ahead and go back down onto our stomachs for our prone extension exercise. So this time what we're going to do is we're going to add a rotational reach. So from my stomach, what I'm going to do is I'm going to extend through my spine, and I'm just going to reach my hand behind as far as I can comfortably, opening through the chest, breathing expansively as I go. And then coming right back onto my stomach, switch sides. So again, I'm just reaching with the hand behind, opening up that lung meridian, breathing, and coming right back onto my stomach. Okay, let's do the other side again. So I'm reaching and relaxing through the breath. Come back onto your stomach. One more time, the other side. Reach. Breathe and relax. Come right back down onto your stomach. Okay, guys, let's go on to our back side again, please, for our supine hollow hold. So remember, if you want to hold this longer, feel free, but I'm just doing 2 quick 15-second sets. Or, yeah, sets. That's what they're called, right? Who cares? Just get into position. And then when you're ready, get into your hollow hold, pressing your low back into the ground, your abdominal area is contracting. But while you're in this position, you want to focus on expanding those lower ribs, front, sides, and back as you breathe. When you need to take a break, go ahead and do that. Take a couple sips of air, and then come right back into it. All right, let's come out of this nice and slow. Let's rock ourselves up to a seated position, please. All right, so normally I would do about 3 different movement series, but today, because I'm doing a session more focused on recovering after a cold or a sinus dynamic, I'm going to focus on more of the recovery aspect today and add some specific stretches for some of our neck muscles, our scalenes, our traps, levator, on some of the deeper muscles of the throat, the longus colli, etc. So what we're going to do first and foremost, we're going to take our right hand, we're going to place it on the left side of our clavicle. You're going to gently drop your head back in the other direction, and you're going to focus on a gentle stretch to the front side of the neck. So while you do this, if you want, you can always add a little bit of tactile cueing and support to relax the tissues that you're trying to stretch. You can also add gentle rotational movements of the skull. Breathing in deeply and expansively, pressing through the crown of the head. Make sure you're nice and long through the spine while holding those ribs down in front so you're not flaring through the ribs. Nice and relaxed. For me, I'm always adding some finger pad strokes up through the base of my skull on the back side. Oh boy, does that feel lovely. And then we're going to switch sides. So let's go ahead and take our left hand, place it on the right side, and then drop your head back in the other direction. Now, if at any time you do any movements like this and you start to feel lightheaded, I don't expect that you will, but if you do, just know that it's a sign that you need to come up out of it until you recover. If you go back into it and you feel it again, it might be something that you need to have checked out by a medical professional, but it's not something to be worried about. It's just something that needs your attention. When we're in this position, the vertebral artery is kind of in a compressed position of sorts. It's not compressed, but it's not ideal for the flow. And so if that artery is not optimized or optimal, then sometimes we might get a little dizzy or lightheaded. Again, I don't expect that's going to happen. It's just something that I like to put out there for those of us that might have some dynamics that need some attention. Again, you can use your hand to kind of massage into the tissues that you want to open and relax. This movement is for a lot of the neck muscles, but especially the scalenes. The scalenes are originating from the transverse processes of your cervical spine and attaching to the first and second rib, which is right behind your clavicle. So we can use some finger pressure just to kind of stimulate and cue those tissues to relax even more. Okay, from here, what we're going to do is we're going to go and just drop our right ear towards our right shoulder. And when we do that, what we can also do is take the left arm behind the back. So now we're getting a nice, beautiful, gentle stretch through the trapezius. Now the trapezius actually rotates the head to the opposite side. So to add to this stretch, I want to encourage you to rotate your head towards the same side. In fact, many of the neck muscles, the scalenes, the traps, the sternocleidomastoid, they rotate the head to the opposite side. So when you're doing a stretch, you want to add gentle movements that help to really refine the productivity or to get more out of the stretch for you. So you're using the sensations and your attention on the sensations to get more out of it. Inhale, exhale. You can add some gentle movement as you go. Passive stretching is good, and active stretching is good also. They do different things. Okay, you can add some gentle compressions into the top side of the shoulder, just massaging anything that doesn't feel good. And it's not about how far you could go. It's about how well you can love yourself and honor where you're at. And see if you can't take yourself 1% further each day. Mind, body, spirit is pretty much the same thing. Every day focusing on a little bit of improvement. Not perfection, just improvement. Inhale, exhale, nice and relaxed. And then let's switch sides. So again, if you want to do this in another way, you can place the hand behind your back first. Get your shoulder in position, get your chin in position, get your head moving towards the ceiling, and then when you're ready, enter the movement. And slowly lower that ear towards the shoulder. Squeeze the muscles, relax the tissues. Inhale, exhale, nice and relaxed. I'm so serious right now, I can't believe that I haven't coughed yet. I was coughing like, I don't know, every couple minutes before I started doing this class this morning. Not so much now. Add those gentle neck movements. Nice and relaxed. Okay. So from here, we're going to start to take our finger pads and we're going to massage right at the attachment site at the base of the skull, okay? The sternocleidomastoid specifically, and some of your erector muscles, one of the erector spinae muscles, attaches right here behind your ear at the base of the skull. So you're going to take your finger pads and you're going to press up and gently add some cervical and just overall spine movement. You can tell that like when I'm moving, I'm not just moving my neck, but I'm moving my whole spine. And you can use your fingers to support your neck. You can add whatever movements that you like. And all of the attachments of our muscles go much further than what we're taught in school. When we learn about muscles, we teach origins and insertions. Problem with that is that the muscles don't just attach to the bone, they attach to the skin of the bone. And they don't just attach to the skin of the bone, they're designed to connect to the other tissues so that way when you move, your muscles distribute load. So what that means is when I'm doing massage or stretching, I want to take my attention beyond the attachment site. So if my sternocleidomastoid mastoid process is connecting here. I want to go beyond with my stroke. So watch. I take it beyond the head and beyond the sternocleido-clavicular clavicular area. And then when I'm ready, switch sides. It's so easy. It's so fun. Knowing that we could do so much with our bodies. Knowing that we could become better stewards of our temple. And that we can massage the body with movement. Breathing is a movement. All the movements we've been doing today, those are movements. And adding tactile cues to get the best release by stimulating and activating our nervous system, all the mechanoreceptors, which, by the way, you have about 70% more mechanoreceptors or nerve endings in your connective tissue than you do the muscles themselves. So the feeling body is your fascial body, your connective tissue body. Okay. Let's go ahead and just get some nice gentle circles of our neck. So you're just going to do some gentle movements, moving your head around in a circle. Move the other direction, nice and easy. Let's add some nice shoulder movements, rolling those shoulders forward. And then roll your shoulders backwards. Perhaps interlace your fingers behind your back, opening up your chest, keeping your ribs down in front, and then doing the same exact thing. Make sure your breath is deep and expansive and that you're focusing also on the rotational aspect of movement. Okay, guys, let's go ahead and lay on our backs, please. Now, from this position here, we're going to take our hands on our abdomen and we're going to start to do some gentle circular movements. But this time I'm not gliding. This time I'm just taking pressure and I'm applying it into my abdomen and I'm just doing gentle circles, just like so. From here, I'm going to gently walk my fingers around through the abdominal area. I'm going to add those full palm gentle strokes from the side of the neck down through the sternum and into the abdomen. And then from here, I want to give you a moment to add whatever movements you need to add. So for me, I need a little bit of extra movement in through my hips. So I'm just going to add some gentle movements by bending at the knee and rotating through my spine. I'm not trying to contract, but rather trying to mobilize. Movement helps to increase our circulation. And sometimes when we have discomfort or pain, it could be a result of blood or chi or energy stagnation. So we just want to focus on relaxing ourselves as much as possible, staying centered in faith and the knowledge and the wisdom that your body's always healing. Let not your heart be troubled, fam. When your body's not feeling so great, that's just a reminder to celebrate. Woo! My body's wired to let me know something's not, happy or ideal. But it's also healing while you're feeling that discomfort. We want to tune into that and help our bodies to do what it's already doing. All right. I don't know about you guys, but I'm pretty stoked. I made it an entire hour without coughing once. That was amazing. I want to thank you guys for joining me this morning. I hope that you guys had a. Oh no! My thing was disconnecting. Is it better? Am I on? Are you guys hearing me? Seeing me? That's super lame. I should have seen that earlier. Oh, okay, good, good. I was like, oh my goodness gracious. All that good stuff. I hope you guys enjoyed yourselves today. Um, no, I don't think it was you, Danielle. My computer said a little something earlier, but there was a few moments. Yeah. Um, hopefully it didn't cut out too much. Yeah. Oh, okay, good. Um, so anyways, thank you again for being here today. I had so much fun. And like I said, you know, this stuff works. I came into the class. I really didn't know if I was going to be hacking up a storm. I had something ready to cough into. I had some water ready to drink. I was like, well, I'm just going to do my best. And then I thought, well, I better just do what I would do if I wanted to try to heal or help my body heal itself. Good. I'm glad. Um, oh, good. Yeah, of course. These movements that we do, they're so important for recovery. And even though a lot of our classes have a focus on recovery, today's class was really important for the respiratory aspect. So I hope that you guys enjoyed it. And I know by next Thursday at the very latest, I know I will be 100%. And I'm just putting that out there as something that's going to happen. So get ready for some more strong movement next Thursday, same time, same channel. And again, lots of love to all of you. I can't see you, but I can feel you, and I know you're there with me now. Take good care of me. I will, Cindy. Thank you so much. And you guys being here today was helpful in taking care of me. So thank you again. I so appreciate it. And I'm going to go ahead and see if I can't post this video.